Welcome to Beyond the Diploma, where we discuss navigating the university experience in Canada and share insight and tools for success. I'm Octavian Turner, and I'm an undergraduate chemistry student at the University of British Columbia and a clinical research assistant in the Division of General Surgery at Vancouver General Hospital. Today, my guest is Aidan Lynch. Aidan is a good friend and a second-year pharmaceutical science student at the University of British Columbia. He recently transferred from Queens University, where he was studying health sciences. Aidan is a pharmacy assistant at Pharmasave, where he is responsible for preparing prescriptions, blister pack making, and communicating prescriptions with patients over the phone. He also checks patients in for vaccinations and updates their immunization records on the ministry site. He has a wide range of volunteer experiences, including camp leadership, environmental preservation, and event organization. Today's discussion covers his experience at Queen's University in their Bachelor of Health Sciences, his experience living abroad, the process of transferring between Canadian institutions, his motivations for transferring to UBC and into their Pharmaceutical Sciences program, and how he became a pharmacy assistant at Pharmasave. Aidan Lynch, welcome.
Hi. Thank you. Thanks so much for having me.
So the first section we're going to cover today relates to your experience at Queen's University and your experience during COVID as well. So I'm going to start by asking you which Canadian universities you applied to and why you chose Queen's.
Well, I actually applied to quite a few, mostly in Ontario. I applied to Queen's, Guelph, and also Brock, I think, in Ontario.
Okay.
And I applied to UVic here in BC, and I also applied to McGill as well.
Did you apply to all sciences, or did you also apply to some arts programs?
It was all sciences.
Okay.
Yeah.
Okay.
But different programs like across.
Okay.
So health science at Queen's, and then I think I did like biochemistry at UVic and at like McGill as well.
What attracted you to the health sciences at Queen's? Is there something specific?
Well, I think at the time, like coming out of high school, I knew that I wanted to do something in the medical field or something in the more kind of like medical side of like the scientific field, and health science just kind of felt like the right choice for that. It's kind of like a program that's very mixed in like what you do, and it was a little bit more broad while also like covering all of those interests I kind of had for something related to medicine in that kind of like scientific field.
Yeah, I remember you telling me first year like about all the different courses you were taking. They're pretty cool. I know you took like bio and chemistry, but you were also taking some like cool sort of health and policy sort of courses, weren't you?
Yeah, so the first year I think I did a pharmacology course and a cell biology course that were specific to the program. And then we had another course that was, I think it was Glyph 170, and it was global and like population health. And that kind of looked at like the population aspect of health and like disease around the world, and a lot in Canada like as well. So that was pretty cool. Yeah.
It's kind of cool how that was first year, right?
That was first year. Yeah.
So it's kind of cool. First year, you kind of get exposure to a bunch of different things. And then.
Yeah. That was like, I think that was a big thing like about that program, was that you kind of covered like a lot of the fundamental stuff. So you kind of had like the cell biology that covered some of the biology, and you still had to take like chemistry, regular bio, but then you also had these courses that were more specific. Like there was like a pharmacology course, there's like, global population health. There was like a history of medicine course, another like anatomy course. It kind of like got you to the same place like you needed to be by the end of like the 4 years, but it was a little bit like less of like the fundamentals, if that like makes sense.
Yeah, it does. When you were researching the program, are there sort of some sort of specializations that, or sort of focuses you could have pursued in the senior years if you continued with?
Well, it was a pretty open program in a way. So for the first 2 years, you kind of had a similar structure in the program where you had to take 5 courses each term. So that was to get your like 15 credits per term. for the first 2 years, 3 of those courses were like mandatory courses that you had to take. So again, I think like for that first term, it was like a pharmacology course. It was like a specific cell physiology course, and it was also that global population health one. And then you had to pick for your 4th course from a list. So I think I did chemistry for that one. But you could pick from like chemistry, biology, like physics, math. There was like a bunch of ones, but it had to satisfy. There was like, I think, a list of 10 that would satisfy for the degree. And then you had to take just an extra elective as well to finish out those 15 credits. So I think I took chem and bio like full year as my electives.
So that's nice. That offers some flexibility.
It was nice to have the flexibility for sure, I think. Yeah.
How would you describe the size of the program? Was it sort of one of the larger programs, or?
I would say it was definitely smaller than general, because unlike a more general program where you're kind of grouped in with everyone and you specialize in the second year, this program, you basically already have your like specialization in the first year. So it's a bit smaller. Again, like you're with the same students for like those special classes. Like those are the only people who are taking those courses are people in that program. But it was, I think, about, I want to say 250 people were in that.
Okay. So sort of moderate in size.
It was definitely like bigger than some of the other like specialization kind of like programs that I've seen. But I think like kind of like health science is pretty like popular. In fact, I think like the one at Queens was actually modeled after the health science program at McMaster. And I know that that's kind of like a really popular one. I think I was talking with someone about it before, and I think they actually even ended up being such a popular program to apply to that I think they actually expanded like the amount of slots in it. Yeah, so I think it was supposed to be lower, I think, and they actually ended up letting, I think, about 250 people per year in instead.
Were there some high GPA requirements you had to maintain to continue?
It was more of like a kind of like a credit requirement. Like you had to meet certain credits, like a certain amount of credits in certain areas. As far as like GPA, it was, I think, at like a 2.35 you had to maintain to actually like get your degree at the end. Okay. Which I think is about like, I think it's 70 to 79%. So not like too bad.
Yeah. I only ask because some programs at UBC, they have, pretty high GPA requirements for the more sort of elite, smaller programs like CAPS and stuff.
I know like mine now, it's higher for sure.
Yeah.
Like that one I don't think was too bad, but this now I think it's like 80% or something. It has to be.
Yeah. Well, we'll get to that. Your program's much smaller now. I think there's like 65 students.
Yeah, no, much smaller.
So we'll get to that. So we're the same year, and I remember when we applied, we had some friends who actually moved to Queens during COVID and lived on campus.
Yeah.
Were you on campus, or were you one of those students?
No. So, I mean, I don't know if I'll say unfortunately, but I guess kind of like unfortunately, I didn't have the opportunity to go for that first year of COVID. So I was here in Vancouver, BC instead. And I pretty much just like stayed, in the house for that whole year because of the pandemic. We weren't really allowed to do anything, and there wasn't really like, a campus experience that I could kind of have when I was here and not there.
Yeah, I think, the COVID experience at university was definitely different for everyone. Like being at UBC, there weren't classes on campus, but there were sort of, safe meetups with people and stuff. There were still some not events, but I made some friends first year.
Yeah.
That's all I'll say. And I'm wondering how that experience was for you online, and if that was difficult, and maybe like how group projects might have helped with that. Or...
Yeah, it was a weird experience for sure. Like it's strange, like having your only interaction with like all these people be kind of like online like that.
Digital, yeah.
Yeah, it was still like a little bit, there was like a social aspect to it when we'd do like tutorials and stuff like that. Because then you would actually kind of be in a group with other students and you'd kind of have the chance to talk. But I mean, like you know, during lectures and stuff, there wasn't really like, oh, like you go into the lecture hall and you kind of like have a few minutes to like chat and kind of get to know the people. Like you're just like, you know, in this Zoom meeting, everybody has their camera off. And
did you have yours
like,
on?
No. No, there's like, you know, there's like the usual like one or two people at the top have their camera on.
I remember I was in this English class first year and I had my camera off, of course.
Yeah.
But then the prof makes a comment about my name. And he was like, wow, Octavian, that's a very unique name. My camera's off. And I'm mute. I'm like, oh, thank you. It's like the end of class.
I know. I had that happen to me too one time where like I had the mic on and I didn't realize. And then I just kind of like, you know, I'm sitting there and I let out like a big sigh. And of course, you know, then the light pops up and like my camera rushes to the front of the screen so everybody can just see that it's like me that did that. But oh well, you know, that kind of thing happened like back then. So
what would you say was the biggest challenge, you know, despite COVID, but like you could also consider that like first year, what was the most challenging part of health sciences?
I think the most challenging part was probably the school aspect, like getting used to the workload of a university kind of like course load.
Mm-hmm.
I think it's like one of those things where you don't really know how it's going to be until you actually kind of like experience that. I mean, I guess, you know, but
yeah.
In high school, you kind of like take a lot more courses, but there's like a lot less work. In uni, there's like, you know, you take fewer courses, but there's just like so much to do. Like, I feel like every week you're doing, you know, like what would be like an entire unit of some course in like high school. And I think like that was hard to get used to, more so like in the first term, but it's definitely hard to like all of a sudden have kind of like that big of a workload.
Yeah. It's a big learning curve.
It's a big learning curve for sure.
Yeah.
Yeah. I mean, I think that like the social aspect was hard too, but I think that was more so hard, like more so had an impact going into the second year, because in the first year, it's like, at least I was still in my home city and like, you know, like you were still here, like all my friends were kind of still here. It didn't have as big of an impact then. But going like away and into second year, I think then that's where that kind of had more of an impact, where there like weren't connections made from the first year, or not like enough connections to really feel like I was in a nice social position.
Mm-hmm. For me personally, first year, I found motivation when I was working with other students and we're like figuring out how these classes work, you know, how to find when all the quizzes are, how do the assignments work, because, you know, we use Canvas at UBC, some other schools use it as well. But at first it's like, oh my gosh, like, where's the schedule? I know, like, you're looking, is it in the syllabus? No, it's not there. And then Piazza explodes, which is like an online discourse thing.
That's like, that was hard, like, especially like the first term of the first year, because nothing is unlocked. So you can't look at anything until the day classes start. So the morning classes start, it's like hectic.
You're in the deep end.
Yeah. But the one thing that I will say was like really good about that, and I think like this stayed pretty consistent like throughout my courses and throughout the terms as well. I don't know if it was the same for you, but for the first like few deadlines, the teachers were generally like, okay, like you have an assignment for week 1, week 2, and week 3, but all of them are due on week 3, to kind of give you like that grace period. So like, just in case you can't find the assignments or something, or like you don't know how to work it or like hand it in, you're not kind of like being penalized because you just like don't know how to work the system yet. Yeah,
that was nice.
That was really
sort of
nice thing.
Gently, you know, accepted us into their program.
Yeah.
Did you have the option? You mentioned you had the option to, you know, pick from a list of courses.
Yes.
There's commonly, you know, organic 1 and 2.
Yes.
Was that an option for you to take second year? Could you have done organic 1 first year, first term, second year, and then?
Yeah. So I did like the first orgo on the first term of like my second year. I didn't do the second one. It was like optional.
Okay.
So you didn't need to take it to finish the program, but it's like one of those things where, you know, orgo, you pretty much need it for, I would say, like most kind of like medical professions, like graduate school, like anything in that kind of field, you kind of, you know,
I think it provides a good
that one.
foundation
Yeah,
for a
I
lot of
would
other
say
courses and
like
stuff.
it's a good one to take. Like they were definitely, it was nice having those like optional courses, and it was nice that like, you know, if you didn't need to do it, then you didn't like have to. If you like didn't want to go to graduate school, you didn't have to do it, or like if your graduate school doesn't require that as a requirement, you didn't have to do it. But I would say like, you know, there was always one course like that, like even like chemistry first year, like Orgo, where like pretty much everybody in the program did it, because pretty much everybody has that like same goal of going to med school or something close.
In the beginning.
In the beginning, yeah.
What would you say was, what did you like most about the degree while you were in it?
About the degree, I really liked the content. So we kind of talked a bit about the courses and how they're a little bit different than like if you just did like a general science for the first year. And yeah, I really liked having those courses and having it just be, I don't know, like something interesting, something related to like med. Like it was kind of like just an early exposure to how they could be used kind of like practically. Like, I don't know, just like taking pharmacology or something, or like the global population, like health and disease. Like it's just, that's something where they were kind of like still, we were learning like the fundamental things that they needed to teach us. But it was also kind of like they were showing us like practical applications of it. And I don't know, it was really interesting. It was really cool to like have it that way. And it made it like, again, I took kind of like the biology and I took kind of like the chemistry as well. And whereas those kind of felt a little bit more like they were just like the high school courses, but like harder, this one kind of had some like new stuff, and it made it like more fun and like more interesting to have those aspects to it, instead of just kind of being like the principles or like the math or the basic like chemistry behind it.
It gives you exposure to, you know, career opportunities, different topics and things that you didn't know about.
Well, it's funny you say that, because I mean, pharmacology course in the first year, and I mean, I was kind of like thinking a little bit about maybe doing pharmacy. Like I would say I was pretty undecided going into first year, but I think like that was the course, like that was the thing that kind of really sold me, like I love this, like I really like this. So
well, that's really cool. I wish I didn't know about the health science. I didn't even know, frankly, that you were applying to that.
Yeah.
I didn't know that was a thing. I didn't know McMaster had it.
I mean, it was like, I'm going to be honest, like applying was like, it's tough applying. Like there's so much choice, and it's like, how do you even like, looking back, it seems like so simple, but I think doing it when you don't know, like,
it's tough.
It was
like, there's so many options. You feel like you're making a career decision. To some degree you are, but I wish I could take like, I guess I could take pharmacology courses now, but I wish first year I would have been like, I got that exposure, because I think that could totally alter your course and career path, you know, getting those exposures early on. Did you find it was difficult? Oh, I already asked you that. Did you ever consider switching programs while you were at Queens?
No, I did not. I actually like, I really like that program. I like, if I had stayed at Queens, I like wouldn't have wanted to switch. Like that was definitely like the program for me there for sure. I really enjoyed it. Like I don't think, like again, it kind of hit like the same fundamentals that like the general science had, but I just liked that, like that extra bit it had, you know. I don't think I would have wanted to switch to something outside of science, and I don't think like switching to general science like would have been like more fun
or aligned with what you wanted to do.
I think that like it was a perfectly good program for like the kind of path I was going on, and I enjoyed it. So
How did the sort of the style and types of courses change first to second year? You know, first year with most degrees, you're sort of fixed to this timetable that you have to take. Second year, it sounds like you got a little bit more freedom, but you know what I mean?
Well, second year,
Were there more projects in sort of?
There were more projects in second year for sure.
Yeah.
I think that the course content definitely got harder. It got more, even though we had like kind of some practical like applications and stuff in the first year, it was still like a little bit more specific in the second year. Course-wise, it was about the same freedom. So first and second year, it was like the 3 required courses, pick one from the list and take one elective. And that was for both terms. Same for second year. Third year and fourth year is where it really was like, you only have to take like these 2 courses and pick from this list of like 40 courses for your remaining like 4. So you got a lot of choice. And of course, I didn't end up getting to make that choice, but there were a lot of cool courses in there. So I think like it was a cool degree in the sense that you really got to kind of like choose how you wanted to finish it and like what you wanted to pursue in it while still getting the like degree at the end. Like there were a lot of ways to meet the requirements.
Right. Transitioning first year to second year, were there more courses with elements of writing? Like a lot of courses, they've got, you know, midterms and then the final, some quizzes. Some other courses, though, they'll have like an essay or something like that. Were there essays second year? Some courses? There
were some. So we had a similar course. So the global and population health course, we had a second, like the second level up of that in the second year. And those 2 courses, that was commonly what we actually had to do. So there was a lot of writing for those courses. I think the final sort of like project for that one, we had like an exam and we kind of had like a final project. We were given a like kind of like a health problem, and then we had to kind of give like a solution to that, and write up kind of like our reasoning behind it and use what we learned in the course. And that was like, like a pretty big.
Based on like current research, or was it a more of a historical? Or
it was like I guess, like looking at the past, but also like in the future, it was kind of looking at like a problem that we hadn't really like solved yet, you know? So, and then implementing like a health intervention. So that was pretty cool. That was like a lot of writing. There was also like some courses, it was basically just like, you know, you get a big test at the end and that's how you do it. There were more like case studies. We had one like physiology course where we would kind of like do the work like on our own and kind of like read the content, and then we would go in like every week and we would do kind of like a lab where we would complete like an exercise in a group. I would say there was more like writing and like more projects and things in the second year.
That's more exciting, personally.
Yeah, it was more exciting. Yeah.
I'm curious about the labs and how that worked. Like first year during COVID, there were some like digital programs. So at UBC, our general science labs were pushed to the summer, and they were actually talking about setting up like sort of a mini program where they were going to house us on campus. I don't know if some people remember that, but that was super exciting. We were all going to stay in like a residence. There was going to be like food, and there was going to be like a boot camp is what they're going to call it. Anyways, for funding reasons, probably that didn't happen. But when I got that email, I was like, oh my gosh, like this would be so cool. So I didn't really experience the sort of digital labs where you're like dragging and dropping, you know, your pipette into your beaker and stuff like that.
Yeah.
So, did you have that?
We had that. Yeah.
Okay.
So for the entirety of like the first year, that's what it was. And for like the second year, the one term that I did, like Orgo, it was that as well. So very minimal lab experience because of that. I mean, I know it's like, it's back to normal now.
Well, it's like you get in the lab, it's like, where's the drop down menu?
I know. Like, well, how do you think I felt like this year?
Yeah.
Like, that was weird. That was a weird transition. Like not doing a lab in person, or like doing it in high school, but like it's different when you have to go there. And then, you know, like after the first week, they like show you all the stuff and they're like, okay, we're going to have like a lab exam like next week. And if you don't pass this, then you can't take the course. And I'm like, I'm sweating, you know?
Yeah. Second year though, were there labs in person? at Queens?
I think there were some,
Okay.
but for the Orgo one, there wasn't.
Okay. So did you take any though? No, you didn't. So
No.
so you didn't really take any in-person labs until
No.
now when you've switched to UBC and you're taking the analytical lab 211, right?
Yeah.
Okay. So we're going to wrap up this section. My last question to you though is for those who are still, they're considering health sciences at Queens, they're a little unsure. I'm curious who you'd recommend this program to. What sort of interest might they want to have that sort of align with this program?
I would say that I would recommend the program to someone who wants to go into a more like medical side of the STEM field for sure. If you want to go to like med school, or even if you want to go to like on to become like a pharmacist or even like a veterinarian or something, potentially something kind of like along the field of medicine, I would say it's like a good fit. It's a good program to do if you don't know exactly what you want to do. Because
in health science.
Yeah, because it gives you a lot of like choice, and it kind of like exposes you to a lot of different areas of like medicine. So again, we had like pharmacology, which is something that you wouldn't really like have in like just like a general science kind of like first year. I would definitely say, like if you're someone who isn't sure of exactly what they want to do, but you know that you want to do kind of like something in the field of medicine, it's a really good program. I think that like you'll have a lot of like interest in it. And I think it'll also kind of like keep your options like open.
Okay.
Yeah.
So the next section is transferring to UBC from Queens. Can you walk me through what you were thinking at the end of second year and what motivated you to transfer to UBC?
Yeah, for sure. I think at the end of my second year, so kind of like coming off of that, what was really like my first year there, I sort of kind of like finally had a proper like feel for the university kind of like experience at Queens. And I don't know, it wasn't really like the environment for me. I think that because of like the pandemic and stuff, and then kind of like going away to school and not really like knowing that many people, and it was like a lot harder like socially, I think that I just kind of like needed like a change of environment after all of that. And that's kind of like the reason that I wanted to kind of come and be back home, and pretty much like everybody I knew was kind of here. So it just felt like it was kind of like the right decision to transfer.
Mm-hmm. Can you explain how the application cycle and deadlines work? Do they sort of align with normal undergrad admissions? So the deadline for typical undergrad admissions sort of in December, right?
Yeah. So sorry.
No, go ahead.
It's like more or less like the same. Okay. So in terms of like the yearly cycle, it lines up. So you kind of start applying, it opens, it's different every year, but it's usually like in October, like mid to late October. And then you're sort of like doing your application. There's an early admission deadline in December, and then the kind of late one in like around like February, like mid-February. And where it kind of differs really is just like hearing back from the school. So whereas you might hear like, I think as early as March, you can hear from like UBC if you're like, a first year applying. I didn't hear back for like an interview until April. And then I didn't hear back till like to know whether I got in or not till close to June. So it was well into the spring by the time I heard back.
So there was an interview.
There was an interview, yeah.
Just specific for this program or general when you transfer?
Program specific. So for the Bachelor of Pharmaceutical Sciences, which is the program I'm doing now, there was an interview to enter into it.
Which we should just clarify. I believe there's also a Bachelor's of Pharmacology, which is a Bachelor of Science. Yes. So I'm not sure. Do you know the difference? We can talk about that later.
The exact difference, I'm not 100% sure.
It'll be clarified on on Aidan's page. We'll clarify.
Yeah.
It's okay.
Thanks.
But another question I had is,
Yeah.
though, can you transfer between terms 1 and 2? Do you know? So could you?
As far as I know, the answer is no, you can't. There might be an exception where you could like delay a term and start in term 2, depending on what courses you had credits for. But it would still like would line up with the application cycle deadlines. So you would just like apply for fall of 2024 and then, but you could like, I guess, start in the winter if you delayed it.
It would make sense too to sort of start at the beginning of the session, because a lot of courses are sort of prerequisites, term 1 and term 2. So
yeah, so that's the thing. Like, I think you would have to have the prerequisites in order for that to happen. So it'd be, I think it's pretty unlikely that would be the case, but it could be different depending on the program, right? Like if you were doing that exact program at another school and the course is like really lined up, then it's totally possible that you might just happen to have like a term's worth of courses that you can now use as transfer credit.
Right. I'm curious about the documentation you sort of needed. Did you need a letter recommendation and a reference?
No, so it was actually super like straightforward. I basically just needed to apply and do like a UBC application, and then I needed to provide my transcript, which of course, because I'd completed my second year already at this point, I just like had right away. Like one thing that I noticed that was like really different is I didn't have to write a
entrance exam.
Yeah, no entrance exam. I didn't have to write a personal statement, which was quite interesting, like I found. I was kind of expecting that, to be honest, when I went in, but then I emailed them and they were like, actually, no, like you don't have to write it.
Interesting.
Yeah.
How did your credits transfer from your health sciences degree to pharmaceutical sciences?
They transferred pretty well. So like I kind of said before, we still go over like a lot of the fundamentals and stuff in those courses. So they actually ended up like counting for some of the courses at UBC that were just like biology, like 113, or, you know, that's a made up course.
Or 112.
Yeah. So a lot of them actually like did transfer, even if they were kind of like a little bit like more specific. I was kind of careful as well to take a lot of the like more fundamental courses too. So I did actually like take math. I took like English in the summer. So those kind of like helped transfer over as well. There's a tool that you can use online. If you just search up like UBC like credit transfer tool, you can actually go on and then you select the institution that you want to transfer from. You put in the course code and then you just put in the date that you finished the course. So like Queens University, Glyph 170, you know, finish date, you know, 12/20, and then it'll actually like show you what credits that counts for at like UBC. So I use that like a lot to like see what I had to like make sure that I had the requirements and stuff.
Well, I'll be sure to include that on your your interview in the notes. So that'd be very helpful. Did you come across sort of restrictions for the number of credits you could transfer, or you didn't reach a point where that was a concern?
I was pretty okay. My first year credits, again, like a lot of them kind of lined up with it, so it was all right. For second year, there were like quite a few that didn't really like transfer at all because they were just different than what the program required, so it was okay.
Was it a surprise when they didn't transfer?
I mean,
did you find out like, late or early on? Or?
I kind of knew early on that like it wasn't going to be, and that's just like one thing. Like I was doing quite like a general program, and I think like, you know, doing the pharmaceutical sciences, it's a lot more like specific courses that just they don't have the transfer credits. So I still had credits for like orgo and stuff that I didn't have to take. I had like stats credits was one that I had. But there were a lot of courses that, because it was like a different program, they didn't really end up like mattering so much. And once it was kind of like in the second year, there were some that were a little bit like more specific, I think, and then they didn't really have like a specific transfer at UBC itself.
How were the enrollment services at both UBC and Queens in terms of helping answer your questions and stuff?
They were really good. So at first, of course, like the first thing I did was I kind of talked to the people at Queens and asked them like what I needed to do when I was transferring naturally. And yeah, it's actually really, really interesting because one thing that I didn't know in speaking to them and the guy was telling me is like, because I didn't know if I had to like withdraw or like formally let them know, but you don't have to tell them anything. So you can just go ahead and
apply to transfer.
Yeah. He was telling me, he's like, you don't need to tell me any of this stuff, but I don't know. I found that really interesting because I kind of thought that you would have to do something a little bit more formal and give them more notice, but as long as you don't kind of like sign up for your courses for the next term, then you're just kind of like dormant in the system and you can, you're welcome to kind of transfer.
Would you have done things differently looking back? Like, are there certain things you wish you would have known before applying to transfer?
I think it's like less so about what I wish like I would have known, and kind of more so I wish I would have like known what the process was like, so I could have like set it up a little bit better.
Okay.
Earlier.
Started earlier on?
Yeah. Maybe? What might have been like if I'd known that I kind of was thinking about transferring, and that was kind of hard because I wasn't there the first year. So I kind of like my second year was kind of like where my first year would be, and then the transfer process would have been easier. Then I probably would have like set my second year courses up a little bit better to maybe transfer with like more credits, or potentially even just transfer from second year into third year, which is again really hard to do. You know, it's very unlikely that your courses are just going to kind of blindly line up.
Right. I'm curious about now the academic culture and what you've noticed and how it differs between Queens and UBC.
Ooh.
So I'll tell you my experience. I feel at UBC, it's very like cutthroat, and everyone's very studious, and I can imagine that's the case, you know, in most institutions, but I wouldn't say it's toxic either, but it's like definitely like competitive, and everyone's like competitive and they talk about it. How do you feel transferring?
I think that I would actually like, surprisingly, I feel like in terms of at least like student culture, like in my program, I think it's a little bit more relaxed than it was.
Really?
I think that when I was in the health science program, like before, it was quite a like a hectic environment. Like it was very stressful. I feel like there were a lot of people who like took it almost a little bit like too far, you know, into like making sure their grades were like perfect, and it could be really stressful for kind of like everyone in the program. Like I knew a lot of people who would kind of like just like stop looking at the group chat because it got a bit stressful at times. I don't think like the program itself like wasn't super stressful. I think that probably like the courses so far at UBC have been harder than the ones at Queens, but I do think maybe it's because like it's a smaller kind of cohort of us now, but I do think it's like a little bit more chill in terms of how people are acting. But I'm sure like, you know, the pandemic kind of had a big thing to do with that as well, and like
everyone was worked up.
Yeah, I think everybody was kind of a bit burnt out from that. So
I'm curious, so the program that you're in, like I mentioned earlier, it's smaller. It's about 65 students.
Yes.
Do you find you found some study groups or some people that you're sort of connecting with?
Oh yeah, for sure. Yeah. Like, already, like it's been maybe like not even 3 months yet, and like I've already made like, you know, so many friends, and like, again, I think this has to do with it being a smaller program, but like I basically know like everybody like already.
See, that's really cool.
And it's really
almost like a
nice.
family.
It really is. Like, I am gonna be honest, I really enjoy the people that I'm like with right now. And I enjoyed the people that I was with at Queens. It was great, but I think that again, like largely with the pandemic and stuff, and maybe also just like the bigger cohort size, it was like a lot harder to make those kind of like more personal connections, because I
Mhm.
felt like we were being like moved around a lot and you weren't like with the same
Group.
people. Like if
Yeah.
we had like a tutorial for two different classes, it would be with like a completely different group of people. So it was hard to, I don't know, like keep those connections
Yeah.
when you weren't like seeing those people like regularly. But I feel like this is like every class now. I see everybody
Yeah.
there, and it's a small enough group that you kind of like,
Go
it's
through it
only,
together and
it's like
yeah.
double a high school class size. So you can imagine that you kind of like get to know the people, even if you're not breaking off into like smaller groups. You just like have the chance to kind of.
Well, that's something I've liked, in these more senior years in my program,
Mm-hmm.
is the classes get, much smaller. They're more focused, and I'm curious how, it really depends on how outgoing the people are, because a lot of people I feel aren't necessarily extroverted. I'm not saying you
Yeah,
have to be extroverted, but that definitely, imposes some challenges when you try to talk to them and they're like,
yeah,
it's like, how's it going?
yeah.
Like, what are you studying? And I don't know.
I mean, I'm very introverted, and I
Yeah.
feel like I get that like awkwardness, and like I try to talk to people, and I feel like I'm just like rambling about like weird stuff because I don't know what to say, and
So
I'm
what's
like,
this guy on about?
I just want this person to like me so bad, but like I don't know how to get that. So I think that like there's been a few people in like my program now who are quite like outgoing and have kind of just like been like, I want that one, like group me in.
Yeah.
So it's really nice. Like it's another reason I like this program a lot, is just like the people are so wonderful, and like they really have been like super inclusive and stuff, and it's just like helped a lot to make school like kind of like fun. Like there's actually like a social aspect now, and that's like a big deal to me.
Well, I'm happy to hear that.
Yeah.
Um, I'm curious about sort of opportunities within pharmaceutical sciences. Are there some focuses or sort of routes of specialization you could follow through with that?
So you could do kind of like a variety of things. A big one, I think, for like the pharmaceutical sciences program is kind of going into like pharmaceutical research, or I guess potentially like drug development.
Okay.
More so than like being a pharmacist, like a clinical pharmacist. Although you could take that route as well. There is an option like in the fourth year to do a co-op, which is kind of cool.
Yeah.
I don't know if I'm gonna do that yet.
Why are you on the fence right now?
Yeah,
I'm curious.
I'm on the fence, and it's interesting too because for this program as well, like this year is the first year of like the first graduating class. We'll graduate this year in the spring, so they're kind of like the first ones who are getting that opportunity. So I don't really have a lot of information on that yet because there's not really been like a lot of experience had yet for those people to kind of share.
I was doing a bit of reading because I was
Yes.
curious if there was co-op.
Yeah.
And I think you could get like quite a few credits. I might be mistaken, but like maybe 12 credits for a term.
Yeah, I think like it's designed so that it's like doable to do the co-op and then like finish in that year, I think.
Would you be interested in doing sort of an industry position or a more sort of research academia?
I think like research could be cool. I really think that like drug development could be super cool. Like the research that kind of goes behind that. We've had the chance to kind of learn a bit about that like already in this like first term. And yeah, I already find that like pretty interesting.
Can you give me some examples of some courses you're taking right now? Like, I'm just the names.
Oh yeah, for sure. So we're taking one right now. It's like an enzyme kinetics course.
Okay.
And that one's like pretty interesting because it's all about different kind of like enzymes in the body and like transporters and how like the kind of like drugs are metabolized and like distributed in the body and stuff and excreted. sort of just like the whole kind of like life cycle of like a drug from when it's like taken to when it's like excreted. I don't know if you've heard of like ADME before.
No, I haven't.
Where you have like
what is that?
the absorption, distribution, metabolism, and like excretion,
So that
or like
term
elimination of the
describes
drug.
the whole process?
Yeah, like the life of a drug.
Okay.
So we kind of like went through that,
Cool.
and just how that pathway is like different for like different enzymes, and
Yeah, that's really cool. And how different drugs are metabolized and how they are targeted and stuff like that too.
Yeah.
I was going to ask what you're enjoying most about UBC, but I think you've answered that. So
Yeah. Well, there's a lot of things to enjoy. So
besides the cohort,
yes,
and the program you're in, how are you enjoying the campus and the amenities it has to offer?
The campus, like, it's beautiful. I love that campus so much.
Yeah.
I mean, it's one of those campuses where, like, growing up here, I'm like very used to it. You know, we've been up there like many
Kids
times.
Swimming,
yeah.
basketball,
the farm, like
the farm,
the McDonald's,
the McDonald's.
Like, it's a beautiful campus. Like I genuinely think, like, of all the campuses that I've seen, it's the one that I like the most by far, and it's kind of like its own like mini city because it's like isolated. You have the forest, like the endowment lands.
Yeah.
That kind of cuts it off, and then you have the ocean all around it. Yeah. So
it's a bit of a trek to get downtown too.
Yeah. So it really it's really like a nice environment to be in, and I don't know, it's so green, it's like so beautiful. There's so many like interesting stuff. Like they have, you know, like the big whale skeleton. The buildings are all like super nice.
And it feels familiar too.
It's that's a good thing for sure.
Yeah.
Yeah.
I think when it becomes stressful during exam season, you know, it's nice to feel grounded sort of where you are and surrounded by friends and where you grew up to.
Yeah. You want to like where you're studying for sure.
Yeah. So the next section is about your pharmacy assistant position and how you got that. But I noticed that you took a year off before starting at UBC. And that's when you started working as a pharmacy assistant. Can you walk me through how you got that position after 2 years at Queens, whether you had like a connection or how you went about that?
Yeah, so it was more or less like just kind of like applying to a lot of different places.
Do you have the website?
So
you applied directly to the pharmacy?
I used like mainly like Indeed, which I actually like. I really recommend doing that because it's super easy to just like build a resume on there, and then it has just like a ton of listings. You can easily like search that up, and I know that like I was just like checking that every day, finding like which ones are new. Okay, apply to it. Which ones like you know. I found that I had a lot more success like with my experience applying to places that were not like bigger companies, if that makes sense. So like I applied to like places like London Drugs or places like Shoppers, but it was like a lot less likely that I would hear back from there than if I applied to someone's kind of like personal business that they kind of like owned. Yeah, I felt like I had a lot more success applying there, and I think that makes sense because I think they're a little bit more like open to hiring someone that doesn't have like
all the credentials,
like certain like on paper qualifications.
Right.
Yeah.
What was the interview like? Were you nervous going into that? I
was nervous for sure because it kind of felt like a lot was riding on that for me. Like that year, that I had to take off to transfer, I really wanted to kind of get some experience. So
wait, sorry, I don't mean to interrupt. Did you have to take that year off?
I did, yeah.
You did? Because of how you applied, right?
Because I was transferring at the end of second year, and the way it works, I like to start that fall, which would have been like the fall of 2022. I would have had to have applied
the beginning of
starting in the fall of 2021.
I see.
Yeah. So that kind of goes back to like, if I could have done something differently, I would have kind of like started earlier and like planned it out a little more, made it a little more like safe to transfer, like, you know, maybe just like applied anyways, even if I wasn't sure.
Right. Well, it's smart that you tried to find a position. So continue. So you got the interview, and it was in person, of course, or was
it was in person.
Was there more than one interviewer?
It was just one.
Okay.
For the position that I actually like ended up getting that I'm working out now, I just kind of like went in and I was like, hi, I'm like here for the interview. And they just took me to the back, and it was actually like very quick. Like it was only like maybe like 5 minutes. But yeah.
But he was like, you're hired. He met you and he's like, I like this guy.
I didn't actually find out until like later. It was really funny actually, because they called me on the phone and I picked up and they were like, hey, is this person? And I was like, oh no, it's somebody else. And they were like, oh no, wait, is this like Aidan? Because they accidentally called the wrong person.
or the right person and the wrong name was.
Yeah.
Yeah.
So for a second, and I kind of like recognized their voice and I was like, oh no, I like didn't get the job. They meant to call somebody else. And they were like, oh no, like I was, yeah. So it was funny because my heart kind of dropped for a second. Then I was like,
what a wave of emotions.
Yeah.
What sort of tasks were you assigned in the beginning, and how have you built on those?
In the beginning, it was like mainly like counting drugs for prescriptions. So, you know, like, oh, someone needs like 14 amoxicillin tablets, and then you count those out, you put it in the little kind of like plastic container, and you label it up and stuff. And, you know, you check off all your stuff. Like you check the DIN number, you like circle the number off and stuff and write the date on the label.
You mentioned this software when you're prepping. What's it called? Is it
Kroll?
Kroll.
Yeah.
Okay. So is Kroll sort of the standard sort of pharmacy software?
Yeah. So Kroll is basically what most kind of like pharmacies will use. So I know that like Shoppers and London Drugs, I believe, both use it, and pretty much everywhere uses it. It's kind of like the universal, you know, it's like the Google of pharmaceutical softwares. And it stores like all the kind of information for your pharmacy. So like all the patients, all the information about like what prescriptions they're on. That's where you would do your kind of like filling of all the prescriptions, where prescriptions are like transferred to and from. That's where like, you know, patient profiles are that you're checking when they call in like on the phone for a refill or something. So basically like everything you're doing is on there, and that's connected to like PharmaNet as well for like all the billing and like insurance purposes.
So PharmaNet's for billing?
That it's kind of like the like online health database.
Okay.
If that makes sense. I mean,
is that the ministry site, or that's another site?
No, that's a different thing. Yeah. So I mean, I don't have like too much experience with it because I'm mostly just like really stay on Kroll, because the billing and then also like checking for certain like contraindications that people might have, but between drugs that you're taking, like that is something that like the pharmacist basically has to handle, because I don't really have, I don't have the say for that, right? I don't have the training for that.
During the onboarding process, were there some training courses or modules you had to complete? Privacy, confidentiality?
There was, yeah. So confidentiality. So like the BC College of Pharmacists. So that was the first thing I did on the first day. Was that they took me behind the counter and they're like, you got to sign this thing. And it basically just says that like, you know, I'm not going to release any like patient information or anything. Pretty much I'm not going to take anything that's like from behind the counter.
Yeah.
Outside of the pharmacy.
I noticed you also have the ethical conduct certificate.
Yes.
The TCP2.
TPS core,
core certificate.
Yeah.
Was that required for the position?
No, that was actually required for some of my like university courses though. So that was like an ethics course that you can do online, and anyone can do it. Like you can look it up. Yeah, it takes a little bit of time, like 4 hours. it took me longer than that, to be honest. It took me a whole day, but that was a while ago.
Yeah. Because most research positions, sort of anything sort of health science related, I've found they ask you to have that. So if you have it going in, that's definitely maybe an edge. You're showing like an initiative.
That is a good thing that you can honestly just like, if you have a free day, you can go online, you can do that, and then you have that certification. And yeah, it basically like, I mean, you've done it, right? So it teaches you all the kind of like ethics behind research, and it gives you a lot of cool knowledge. Like I think just like the stuff that it teaches you is cool to know personally, but I do think you're right. Like it does kind of give you an edge if you have that like already.
Yeah. What would you say is the most challenging part of this position? Or what was the biggest learning curve?
Ooh. I would say that like maybe staying calm like under pressure. Like
Okay.
it's one of those kind of jobs where in pharmacy where sometimes it's super dead, but other times it's super super busy and the phone lines are full. There's like 50 people in there, you know, who all want their prescription like refilled. There's like 10 people who are like lined up to get vaccinations, and you have to be able to kind of be under all that stress but like remain calm and be able to complete things efficiently and not like freak out.
And without error.
Yeah,
Yeah.
that's a big one.
Do you communicate? Well, I think you do. You communicate with patients on the phone. Right?
Yes.
What are some things you're permitted to discuss with patients? And then the things you're not allowed to talk about that you would need like more credentials for.
Well, I can like basically see like anything that's on their profile. So like
Okay.
see what they've had, or like if they have like refills left on a drug and they want to refill it, I can like flag that to then be like refilled by the pharmacist. There's not like so much that I couldn't do. It's more like if a doctor like phones in a prescription or something, for example, I'm not allowed to take that down. So the verbal basically has to be given like to the pharmacist to write down. Okay. Basically anything where there's like liability, if that makes sense.
So if a patient were to call in about a prescription and they had questions about like a drug and maybe some side effects,
I would not be qualified to answer that, because if I gave the wrong thing, well, I mean, it would be illegal for me to basically give like advice like that. So
you'd pass your phone off to the...
Yeah, I would usually say like, hey, like I'm a pharmacy assistant. I'm not really qualified to answer your question. Are you okay if I put you on hold for just like 30 seconds and I'll get the pharmacist to check on that for you?
Has that happened before?
Yeah, for sure. I mean, a ton of people call in, and it just happens where, you know, they're calling a pharmacy where a pharmacist works. They have pharmaceutical related questions. And even if I like know the answer, it's just like, it's not my liability that's under, and I don't have like the legal authorization to kind of go over that.
Now there's another position called like a pharmacy technician.
Yes.
So can you explain how that differs from your position?
Yeah. So right now I'm like a pharmacy assistant, which is basically just someone who doesn't really have like any training. Like I've gone through, you know, I've learned how to do things, but it's fairly like basic stuff.
Admin based,
in a way.
would you say?
There's some admin based stuff. Okay. Yeah. I think like for a pharmacy technician, you get more kind of like proper course training. So if you want to be like a certified technician, then you actually have to go and get that like certification. So you could do that from like, I think like Vancouver Career College, for example, you can do a program there to be a pharmacy technician. And there for sure, I think they would teach you more how to use the pharmacy softwares. Like I've learned a little bit kind of going through it, but that's something I think they'd actually teach you. A big one for that is like giving injections. So like injection training, I don't have that, so I can't, you know, vaccinate people evidently.
Oh, interesting.
Yeah.
Okay. So would you say, so you're, you know, pharmacy assistant, and then there's pharmacy technician, and then pharmacist?
Yeah.
But you don't have to become a pharmacy technician before a pharmacist, do you?
No, you don't. So there's kind of like, like a pharmacy assistant, someone who's just kind of like helping out. A technician can do a bit more, and so can like a student pharmacist. So like at our pharmacy, we've had some student like pharmacists before. So they're kind of like in their grad school, and they're just like, they have to do like kind of like a co-op sort of thing. And they have like, you know, the injection training and stuff like that. But ultimately, like in terms of like liability and stuff, that's kind of like falls like on the pharmacist. So they have to kind of have the final check and like final say for everything.
It's a lot of pressure.
Yeah, it is, right? But that's why you go through
responsibility. Yeah.
that many years of school.
What would your advice be to someone who's interested in pharmacy and wants to get a similar sort of pharmacy assistant position?
I would say definitely just like go for it. apply to like as many places as you can. Again, I personally found that there was kind of like more luck if you don't have as many qualifications for applying somewhere that's kind of like a personal business and not like a bigger company, because I think they're a bit more likely to choose a candidate with kind of like better on paper credentials, and I think they also get like a lot more applicants as well, which kind of like lowers the chance. And yeah, I think that like honestly as well, I think if you were like to work at like London Drugs or Shoppers or something, that's a great experience. But what I really like about working at the pharmacy where I'm at is that it's like, you know, it's smaller. Like I know my like boss, my coworkers like really well, and because it's kind of like a personal business, like she's kind of taught me a lot and like shown me a lot more stuff that I don't think I would have otherwise kind of gotten the chance to do. So I feel like very privileged in that sense that like because of that I kind of was like able to get a lot of like attention focused on me to be able to learn these things and really like just get to learn more about pharmacy and to kind of figure out whether or not I really did like it or not, which I've, you know, come to learn that, yeah, like not, I didn't just like it on paper in school, but I really like working there and doing that.
I wonder if there's more of like a rotation of to be pharmacists, like in the London Drugs and Shoppers, and whether at these more sort of private, you know, business ones, that it's more of like a long-lasting sort of team. You know what I mean? Like, I wonder if there's a sort of a co-op equivalent where they cycle them through Shoppers and London Drugs. And
yeah, from what I've heard from the kind of like student pharmacists that have worked there, and also like even like the pharmacists as well, and what they had to do with their like residency or when they were kind of like working co-op, is that you do end up working at like a lot of different places. What I learned from like one of the other like pharmacists there too, who like he had the chance to work before at like London Drugs and stuff and Shoppers, and I think they like cycle the staff around a lot more too. So it's like you end up working at like a bunch of different like London Drugs locations when you're kind of like first starting out.
Interesting.
Yeah. Okay.
Well, my last question for you is you want some water before that?
Yeah, for the big one.
It's not that well, it's actually kind of big. If someone's on the fence about transferring Canadian institutions for their undergrad degree, is they're worried about the extra time added, perhaps the complicatedness at first, what is your advice to them?
So I guess like my advice, like if you're someone who, let's say you're like coming out of high school and you're going to a program you've accepted somewhere, like let's just say you're going to UBC and you're not sure if you're going to like it, and you are kind of thinking that like transferring might be in your future, I would definitely say try and like apply early. Like you can always kind of like apply to transfer and then like not go through with it.
So decline the offer.
Yeah, you don't have to basically give up your position to do that. And I would say it's safer to just kind of like start that application process and have that kind of going if you're not sure. I would also say for sure, like, if you're in like a program kind of like what I was in, where maybe you're not necessarily taking some of the fundamental courses, those are really good ones to have. So like pretty much any second year like level at any university in the sciences, like they're going to need you to have taken like the math and the English and like the first year bio and the first year chem. So I would definitely say like try and have those like if you can. And also if you think that there's like other programs that you might be interested in, I would go to those programs, find out what kind of like requirements you need, and then see like use like, for example, the transfer credit tool and try and see, you know, what sort of courses you can maybe take that would work if you weren't going to transfer, but then also would kind of like would give you credit if you were going to transfer. And definitely too, like if you are thinking of transferring, I would like email like advising and stuff like early for sure. That's something that like I think like really helped me when I was transferring was I kind of emailed them with questions like very early on, and then later on when it was like December and January and it was a really hectic period for people transferring and people applying, because I already kind of like had someone I was talking to and had like a thread with them over email, I would get my questions answered super quick, but I know other people that would only start emailing then and would
Right.
it would be a lot more difficult. So I think definitely just like try and get an early start is the biggest thing I can recommend.
Okay. Well, it's been very helpful.
Yeah.
Thank you for joining us today.
Yeah, thanks so much for having me.